Okay, hi, this is a new video with Cindy, and today I'm going to talk about vet care for your dog and wounds and scratching of the ears. So, Cindy had gotten, she started scratching and chewing her leg, and she started biting it, and I was like, she started gnawing on it. I was like, dang, what's going on? So, Um, I just gave her Next Guard and her Sentinel, so hopefully there's no fleas or anything. Might have been some Camelon she went over, I'm not sure. See, she's trying to scratch her ears, so I'm gonna talk about the ear medicine. Now, the vet gave us this stop kicking, Cindy. Mometamax. Mometamax. It's gentamicin antibiotic, and it has clotrimazole for fungus, so for otic suspension. So this stuff works pretty good. Um, Pull it out. So you get a good sized bottle of it. I'm messing it up. Alright, put it back on. Alright, so here's the Momedics. So 16 grams from Merck. So I've had this a while, and it works really good. So you take up the top, then it has like a. So I'm gonna put some of this on Cindy's ears, which gets rid of any itching or whatever while she's scratching her ears. So I like this product, and it's pretty good, and it's for ears. So put that over here. Now, what else did the vet give us for her ears? She gave us this malacetic ultra otic cleaner, medically formulated for dogs, cats, and horses. Ultra cleaner, otic cleaner. So, I didn't really use this on her yet, but in May. So I tried to get what her issue was with this, and it works pretty good. The Mometamax from Merck. Now let's get back to Cindy's paw here. So the back, she was chewing up this part. So this has been on for a few days, and she was on oral antibiotics because I see they put these like cone things over the dog's heads, and so they can't bite and scratch. I made sure I watched her and told her, not to. Well, to cover it up, then she can't lick the medicine off. Um, but she was on oral antibiotics, so this is all healed up here. I'm gonna change her bandage. Um, what's good to use? The Terramycin is good from Pfizer. It's good ointment. You could use Neosporin or Mupirocin. We had to use clindamycin on her over here to get it all healed up, but her paw was really, 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 inflamed, and but she's back to normal now. So I have this is getting a little dirty, but at least it's keeping her from. So I have a bandage underneath, band-aids, and I'm gonna change her bandage now. But come here, Cindy. So I'm gonna put the ears stuff in her ears, and she just did a little squirt. So her ears look really good, but she's still scratching. So pour a little bit in there. Pour a little bit in there, and rub it around. Check. Let me check. Yeah, you can see it's in there, but a little bit more right in there. Alright, so I'll get that ear good, and she won't be scratching it. Because she can scratch she can scratch her and bleed, cutting them, getting, so let's do this ear now. So this ear, take a look. Take a look at this ear, baby. You see this ear? Yeah, he's looking good. There's a little bit of red in there. So we'll get it in there. Got it in there. It's in there. Just work it around. Just work it around. Alright, so that's the Mimetics. Check this ear. Yeah, so you can see it's kind of wet in there. So yeah, I've done good on this side. Work it in good. Just work it in. Alright. So, that's the Mimetics. I gave her a Sentinel just now and her next guard. So hopefully she won't be scratching. A little bandage she's got on here. So I have band-aids underneath, and then there's ointment underneath there. So we got it both ways. We got it with the antibiotics, oral antibiotics, and then we had ointment. So terramycin is good for dogs. It is mostly for their eyes. You can use, but you can use it on, the skin. It works just as good. So the Mimetics from Merck. 15 grams. It's gentamicin, which is a great antibiotic. It really gets a lot of gram-negative and positive bacteria, and then it's got the fungus. So it gets it both ways. So this gets it with antibiotic and fungus. So it treats both. So whatever the issue is. So her coat looks good. Her paw looks good now. So I'm going to cut this off now and then take a look at what it looks like now. And so let's see if I can cut it off. See how she's doing. I'm putting a new Band-Aid. That's a Band-Aid there. So yeah, her looks like it's coming along. Alright. Let me pull these out. Yeah, I can put my fingers under. So she wasn't getting I could put 2 fingers in there, so it wasn't too tight. Get this out. Alright. Let's take a look at how her paw's doing. And yeah, it's getting a lot better. So she had chewed that up pretty good, the back. So let's take a look now. Compared to this one. So yeah, once the fur grows back, it's starting to look good. Might not need a Band-Aid now. I'll take a look. It's on her. There, I'll pull this off. Go slowly. I'll pull it out. Alright. So, well, she does have some, so it looks like scabs are growing now, and so I'm going to clean it. I'm going to wash it, and then I'll wrap it back up for her, because she doesn't want to get it. So, yeah, starting to get good. Don't lick, Cindy, get over. So, she looks like she's out of the woods, And the fur's starting to grow back. The skin's growing back good. So she was gnawing on it. I don't know what in the heck got into her, but looks like it's healing up. All right, good. So looks a lot better. So I don't have a sit, Sydney. Just gonna get it all clean. All right, yeah, good girl. So I'm just gonna clean it off and with this saline. So this is eye drop saline that so it's just as good. Any type of clean, purified water. That's right. There's no blood now, and it's all healing up. So the bandage did good for her, and seems to me she's getting good. Go, sit, Cindy, sit. No, good. Come here, baby. All right, just throw a little saline on there. Get it all clean. Yeah. So that's good, Cindy. Just getting it clean. Gotta get it clean and put the new sake. I call it sake for her, which is what it was. So yeah. So her leg looks a lot better. She's able to walk. This is not. This was double the size initially. So I don't know what. So with the vet care I have, the antibiotics that I had, and keeping her from biting the back here, so it looks 100%, 100% better. So yeah, so fur is starting to grow back, and there's no more. It's not bleeding anymore. It's she's gonna be okay. So so I'm happy that she's gonna be okay. So this is the new Pfizer. Get out. This is the new Terramycin that we got from the Pfizer Terramycin. So I'm pretty happy that I think she's out of the woods. So we'll get some the antibiotic going there. Right there, so it makes it nice and smooth and heals right back up. And so I'm happy that she's because I hadn't looked at it in a few days. So I knew last time I looked at it was healing up. I didn't want to take it off. She was on the oral antibiotics, so it was all clean. It wasn't bleeding anymore. So I think so. She was chewing the back of the ball of her paw up, and that was a little scary. All right, let me get underneath. All right, so she seems to be okay, and we'll just put a little bit over here to make sure in case anything down there. But this is just the heel. She was hasn't healed up completely, the heel, but her leg there did. Now right there was what was an issue. I'll put some more here to make sure it's good. A little bit more. So she can't lick the oral antibiotics off, but I am gonna take this up and make a little sake for her again. So put that there, and see what they're doing with the little lid. It's all coming out. Okay. All right. So I'm gonna use a Band-Aid. I'm gonna use a Band-Aid. Get it open. Use my teeth. Alright, so this is a nice, thick, soft Band-Aid for her. And I don't know wipe the rest of this antibiotic off on it. It's on my hand. Alright. Don't waste it all. Alright, so get in there, good. Alright, there we go. Alright, that's good. Alright. So I got a lot of the antibiotic on there, the terramycin. And we're gonna put it right on the heel. Right there. So you really want to be careful when they get a wound, because when they start licking it, they've got a lot of bacteria in their mouth, and that's what you really got to worry about. So I was going to use a cloth, but I'm going to use two big Band-Aids to wrap around. She can't lick the medicine off, and she can't bite the area anymore because it'll be wrapped up. So I think it's very uncomfortable, those cones they put around the dog's necks. Of course, you have to, if they're biting and licking all the medicine off or the area, then you've got to do something. But I kind of shoo Cindy away when I'm monitoring her, so I monitor her and I don't let her bite the area. So you can see it's a nice, clean, double bandage there. And then we're going to use the white bandage roll cover. This self-stick, self-adhesive, which is great. So this keeps it dry, it keeps it protected, and I think I have another one I started open. Let me see when I can get going out of here. I think I should be able to get this one open. I should be able to get it going. Yeah, there it goes. Okay, I'll get it started. All right. So then you just wrap it around, and wrap it around her little paw, and wrap it right around. I don't want it too tight. I got the sock off of it. Make sure it's on her heel there. Make sure it's all right. So I'm trying to do it by holding the camera, but I'm getting it the best I can. All right. So there we go. Put the sock over on the poly. Make sure it's up. There we go. That's on there good. Kind of slid down, but I got it back up. All right. So right. Okay, so you can see how I've got it nice and wrapped, and it's not going to be too tight. Where I can put my finger through, and then just wrap it around one more time. Just a bit to keep her from getting it infected. So, wrap it around one time. And then we'll go around. Right. So that's good. So that's it. And then cut it. And then I'll cut it. Alright, so there it is. Alright, she's got her new Saki. I call it a Saki. So she's good. She's got, it's all clean. Right there, it's all healed up. It's not bleeding. I put a little more ointment here. So I'm just dropping the ointment. So there's a little bit of ointment on the bandage thing there. So I'm gonna put that right here. Rub that right in. And then I'm going to use more of this up right here. Alright, make sure I get it good. I squirted a good amount there. And so that's the terramycin. Let me see, Cindy. So just a little bit right there, a little bit right in there at the top. Sure, rub it in good. Okay. So, all right. So I've cleaned her. I've cleaned her wound, and she's got new sake now. It's not too tight. Doesn't look like it's too tight. Yeah, I can put my fingers in there. So, you can see the old one was kind of dirty. So that was for like about 5 days. So I just made sure she wasn't biting this area, licking the medicine off, and scratching it or making it bleed more. So it's healed up, thank goodness. Cindy is healed up. So you have the little terramycin, which is good. Okay. I don't know what I did with the lid. I'm probably sitting on it. Okay. I got the lid. Here's the lid. Alright, so there's a little bit left in here. Put it back in the thing. I've got I got a good supply of these little terramycins. Terramycin you can get from your vet or you can order online. It's one that you don't need a prescription for. So look on the internet for the best deals from a reputable supplier. All right, so that's what you do if your dog. So you can see the old bandage. So it's mostly dirt and maybe a tiny bit of dry blood. But so leaving it on there with the oral antibiotics and not letting her bite it or let her bite it or whatever, get it more infected. So keeping it dry, so this really keeps it dry even if it rains. I think it's like a rubber type latex. Not really sure what it's made out of, but I got a couple of them. So you can get this in any over the counter, Walmart, CVS, Walgreens. You're gonna have to pay a few bucks for a good bandage. But I think Cindy is out of the woods, so I recommend the Momentics for ears. So she's not scratching her ears now. So she has a beautiful coat. So it'd be terrible. Well, she's scratching now. Okay. But she just had her next gardener sentinel, so that should kick in. Don't lick, Cindy. So I kind of shoo her away if she licks the medicine off. But that's why they wear those cones. I think the cone thing is kind of uncomfortable for the dog and the handler, the owner. So you really want to watch your dog if she starts biting and gnawing, especially gnawing on her paws or something. Like she might have stepped in kennel lawn. I don't know what it was. Maybe a bug bit her. Something got her. Something. She's rolling around having fun. So she went scratched. It scratches. So you really want to get up, Cindy. Come on up. Come on up. Get up. Don't go down. Come on, get up. You really want to monitor your dog. And so, at the bottom of her, it's all healed up. So, I'm really happy with the way the dressing is, the way the wound is. So, you've got to, have a little experience handling your dogs and veterinary care. But don't panic. Don't freak out about the bills. I think the carrot keep on supply. A lot of survivalists keep So this is I haven't used this yet, but think about this. What the vet uses this Just let me put it center back. So my camera is getting off lens. This Maletic Ultra Otic Cleaner. So it's got horses, dogs, cats. Medically formulated. So I haven't used this yet. I just went with the antibiotics, and her ears look really great. From what I was able to see today. The Mimetics, that's a prescription. I think it was $65, but I think this was like $30. I don't know what it was from the vet. I have to look at the bill. But overall, I am pleased with Cindy's recovery, and so these these little wipes that I was using to clean the blood, baby wipes, and the saline afterwards. Made sure it was all clean. And I had a nice clean napkin, real thick, nice napkin here to clean. You can use these pads; they're a little thick, then tape up. But you really have to, just be vigilant on your dog's health. There's a lot of pet insurance, so a lot of people don't have dog insurance, and the cost could be prohibitive when you're